Hello, and thank you again for joining us for our Stem Cell Healing Institute series of podcasts and videos. We are here again. This is our second part of the female rejuvenation and vaginal rejuvenation. And here we are with Dr. Jose Lowe. I am Dr. Zara Figueiredo, Director of Advanced Regenerative Therapies. Dr. Lowe is very renowned here in Guatemala as an OBGYN and urologist. And today we'll be discussing aesthetics in the urogenital region, as well as functional conditions and requirements of somewhat medical requirements for functional enhancement of the, whether it's urinary incontinence, whether it's ease and comfort during intimacy, whatever that case may be. Dr. Lowe, welcome. Thank you again for being here. Let's start with some of the conditions that are really popular, that we see. Well, both the aesthetic aspect of vaginal rejuvenation, as well as conditions such as urinary incontinence, vaginal atrophy, clitoral atrophy, and volume, and neuroinflammation and pain. Can you talk about a little bit about that and how we combine them with the stem cells and the results that we see?
This is a very interesting field of the body of the lady, because it starts, like you said in the anterior postcard, that starts at the 30 years, and it has a very close relationship with hormone disorders
and menopause.
And menopause,
yes.
Of course, because the menopause, it maybe is the biggest hormone disorder, the deficiency of the estrogen. And the important thing here is the impact of the quality of life of the lady with this kind of disorders of the body and in the vagina. Principal in the intercourse of the sexual activity. It's very difficult. In the past, they said, that's normal, but the truth is that we have now elements, we have now weapons to fight this kind of disorders of the lady. The stem cells, it has a very important part in this, in the vaginal atrophy, incontinence. In the surgery, you can find more than 600 kinds of surgery for incontinence, and that means that we don't know precisely why the lady has incontinence. The vagina has serial injuries in the birth of the baby, and the laser, the stem cells, the platelets, and the ultrasound. It's a very good physiotherapy for regenerate and have a better muscle, a better tightness of the vagina.
That's right. And, you mentioned for incontinence, for instance, and childbirth tends to be one of the biggest culprits of incontinence, and perhaps weight gain from childbirth, and a little bit of a prolapse in the uterus. So there are various different causes and the vaginal laxity. And so explain to our viewers and listeners how you inject the stem cells for urinary incontinence, for instance.
We can see in the urethra, it's like a tube. Mm-hmm. It has two holes in the beginning and the end, and in the holes, in all the size of the urethra, you can see muscles that the name is sphincter muscle, and it do compression, and that's why the lady can continence the urine. But it's not only the urethra; all the muscles, they are alrededor, how you say, surrounding the urethra. It has to be like a band. It has to be tightened
and the elasticity needs to be restored. And you mentioned something that's really important about rehabilitation, and it's an important point because doing Kegel exercises, for instance, is really important. After any stem cell treatment, we always encourage stimulation. So stimulate the stem cells, stimulate the nerves, stimulate the muscles in order to really activate those stem cells and put them to work. And so that is a really important point, are the Kegel exercises after injecting the sphincter. So we inject directly at the sphincter. We inject a periurethral along the vaginal canal, pretty much, or along the walls.
The walls of the vagina.
Exactly. And then that, along with even intravaginal injections, along with that to increase vascularity, decrease inflammation, help with any nerve damage, because a lot of nerves can get damaged as well, which causes pain and also results in ineffective urinary incontinence and things like that.
Well, it is very important to treatment because it has a important impact in the quality of life.
You mentioned something, the quality of life, as being, that's everything. We can live to 100 years, but if the quality of life isn't there, what's the point? And that's so important, especially in your relationship with a partner, with the basic desires of a human being. And I think that it's so important that you mention that, the quality of life. So being pain free when a woman is intimate, lubrication, elasticity and tightness of the vaginal canal for better outcomes and better comfort, and all of these aspects. The incontinence is so important. I think pain is a big one because after childbirth, we see it sometimes in various different, depending on various different factors, we see nerve damage. We see injuries at the vaginal canal. We see scarring, and all of these are so very effectively addressed by regenerative treatments like the stem cells with exosomes and platelet lysate and the laser, and everything that you do. Can you address a little bit of that for our viewers?
Yes. This kind of treatment is a combination with the functional of the area and the aesthetic. It's very important to see well and to feel well. And that's the objective of this kind of treatment, that the lady feels well and she sees herself well, healthy, and the how you say autoestima, self-esteem, it will be better for her. So it increase the quality of the relationship with her partner, with her social medio social, And that's why this kind of treatment is for us is happy to help to the quality, because it is important to, like I said, to feel well, to feel healthy. And the other thing is that is combined with the detox that you have and the diet. And when you start to detox, you know that you start to feel well, and your body, it will be functional in a better way.
Yes, that's really important that you mentioned that, and I should reiterate the pre-treatment protocol and how it creates that environment, that healthy environment for better and optimal healing, and it's about getting to the root cause of the problem as well. So by addressing the hormones, so in conditions of the vaginal atrophy and clitoral and vulvar deformities, or whatever the case may be, there are hormones involved. There are certain nutritional deficiencies involved. There are certain microbiome, dysbiosis of the microbiome, possibly, even intravaginally as well. So these are all things that we take into account in healing the woman, and allowing for not only a wonderful optimal environment for the stem cells, but also, creating this comprehensive environment of healing for the woman, so she feels better hormonally. Her attitude and any irritability or whatever the case may be, lubrication, we're addressing that in so many different ways along with the regenerative treatments. So that's a really important fact that you mentioned. And I also would love for you in this moment to address how you inject. And again, this is all done under sedation. Okay, we have to reiterate that the patient and the female feels nothing and is not even aware of what is happening. And so this is all done very comfortably under sedation, and injections are done locally as well as IV, done through the blood, where the stem cells are placed everywhere the blood flows. Can you describe when a woman is under sedation and we are doing vaginal injections as well as clitoral injections, perhaps for hyperpigmentation, which is also a nice positive side effect of or addressing hyperpigmentation and lightening the skin, which is a nice positive side effect of stem cell and regenerative treatments. So when you inject the clitoral area and the vulva, the labia, because there's atrophy of the labia, and also perhaps there's asymmetry, and the woman wants that addressed. How do you go about injecting these local areas?
Okay, we try to. First, we explain to the lady what we are going to do. It's very important that she has a conscious that we are going to inject these stem cells in which area and how we do that. Then we, with a syringe, but with an insulin needle, a very thin needle, we try to do little spots of this solution, of the stem cells, of the platelet, in all the, like you said, paraurethral, in the urethra, in the vaginal walls, or even in the lesion that the lady has. We try to be very cautious because, like you do, you have to prepare the stem cells, and we don't have a liter of stem cells.
That's
We
right.
have, sometimes we only have like 15, 20 or 30 milliliters, and we have to
We have to be conservative. And
to
yes,
do it.
because every drop matters.
Yeah.
Yes.
And then the like you said, the lady is in
Sedation. Yes, in the OR.
Sometimes I said they and them to have a little bit of cold ice or something to helps to disinflammate, and they can have cold and warm, because with the warm we can help to disseminate the product that we put in the vagina.
Right,
okay?
right. The heat helps to disseminate and to increase the circulation to absolutely. That's a really good point. And we also want to, so a little bit of cold is fine after treatment, but we limit that cold because to some degree we want the inflammation, and because the inflammatory cascade is what promotes the construction of the tissues and healing. So yes, injecting the vulva directly. Sometimes we use a scaffold with the stem cell cocktail, and so injecting directly for vulvar atrophy, for clitoral atrophy, and for increased sensitivity, which is so important. And then the labia, injecting right at the labia, and all of these also improve. Like, we have so many different positive side effects, right? Not only do we want to help atrophy, for instance, but at the same time we're improving lubrication, we're improving the thickness, we're improving vascularity, we're creating tissue, right? And we're decreasing inflammation. And so we're killing, I always use this expression with my son, we're killing a bunch of birds, right? instead of just two birds with one stone, we're killing a bunch of birds. And that's the beauty of regenerative treatments and the way that the Stem Cell Healing Institute approaches healing, in that, yes, we look at detoxifying, we look at diet, we look at supplementation, we look at oxygen therapy, we look at hormone therapy, we look at providing key nutrients or supplements, herbs, trace minerals, so many factors that play a role in our overall well-being. And I failed to mention, and this is really important, I always say that wellness is not just our physical body. It's what's happening mentally, emotionally, psychologically, even spiritually. And this, I hate to have mentioned it last in the series of everything we do to prepare the body, but it's last but not least, because we always say how stress kills,
yes.
But no one ever, and that's true. It is 100% true. But no one ever explains, how does stress kill, right? What happens is, I always describe it this way, that thoughts are the language of the brain, feelings are the language of the body. So when we have negative thoughts, fearful thoughts, angry thoughts that go in as an electric charge in our brain, it's electric, it translates into a magnetic feeling in our body. And what that does, so that electromagnetic forces, and from those negative thoughts, it translates into a negative chemical in our body, okay? A physical chemical, cortisol, adrenaline, sometimes when we don't want it, the fight or flight response, the sympathetic response, which is, of course, something that we require as human beings to survive. However, when it's there, when we don't really need it, that creates havoc in our body. So these negative chemicals, when they're chronically there, when they're constantly there, when they shouldn't be there, that's what creates damage to our cells and inflammation and free radicals. So when we say stress kills, that's exactly how. It does. So, to reiterate that, I think it's so important that in treating a female for these conditions, and so much of it becomes, like you mentioned, self-esteem, right? A low self-esteem, or stress about, oh, how do I look down there? How do I smell down there? How am I going to perform? To the same perhaps worries and concerns that a male may have. Women have the same. So addressing these concerns psychologically and emotionally are so important in healing and managing stress in her lifestyle. What do we do to manage stress? Breathing exercises, meditation, journaling, praying, whatever it may be. And sorry, I've taken over the mic for so long.
The last thing that I want to ask you is maybe two questions. The first one is, how many sessions we need with this kind of treatment? How often you have to do this? Because in laser and what I do in my office, and I said it's one session for every decade. If you have 60, I will do like 4 or 5 sessions.
Right, for every decade.
Yeah.
That's pretty much the rule of thumb for us as well. With stem cell treatments, we use such an abundance of stem cells and various types in the cocktail. It's so important, the numbers, the types of stem cells being used, as well as the cocktail itself, the growth factors and everything. So we have created a treatment where one time, until normal wear and tear and the normal process of aging happens, which could be, depending on the person, it could be 5 to 10 years. So yes, one session every 5 to 10 years, very much in line with what you practice as well. Well, Dr. Lowe, thank you for being with us today. This has been so enlightening, and your expertise with Stem Cell Healing Institute and us working as a team, a respective team, makes our treatment so comprehensive. With your expertise as an OBGYN and urologist, combined with the regenerative treatments of the Stem Cell Healing Institute, we have created happy patients, and we hope to create even more happy patients, both on the functional medical side as well as the aesthetic and fertility side, which is so important for female health and female rejuvenation. So thank you for being with us today. I want to thank our viewers and listeners for joining us. We thank you again, and please follow us on all of our social media, Instagram, Facebook, TikTok, wherever else we are, YouTube, and you can visit us at our website, www.stemcellhealinginstitute.com. You can email us at info@stemcellhealinginstitute.com, and we look forward to seeing you at our next podcast. Thanks again.